Thank you for staying with us. Time now for us to get into our big stories. And as you've seen, it has emerged from the work done and published in some journals by scientists at the KNUST that there is the presence of unacceptable levels of pesticide residues like DDT in some fruits on the market. This has been noticed in the Ashanti region, especially with watermelon. Let's get into that discussion, talking about the adverse effects, and these can cause cancer and a whole lot of other things. We'll begin our engagement with Professor Nathaniel Owusu-Bwedi, Department of Chemistry at the KNUST. We also have Dr. Charles Nyaba. He is president of the Peasant Farmers Association. Then there's Dr. Kwejo Kusi, an agronomist with the UCC, and Dr. Henry Kwabena Kokofun, executive director, Environmental Protection Agency. Right, so we'll start the conversation with Professor Bwedi of the Department of Chemistry at the KNUST. Prof, a very good morning to you.
Good morning. Thank you for the opportunity.
Right. It is indeed a very topical matter we've brought up, because what we ingest, what we are consuming, basically makes us. Some will say you are what you eat. But what brought about this entire study that the KNUST even embarked on? What spurred it on?
Well, thank you very much. Greetings to your listeners. So there have been previous works done by groups of people, and not by our group anyway, which inspired us to do this. Since 1983, Ghana has banned the organochlorine pesticides, and yet on the market, on the farms, they are still being used, and they are still being sold illegally to farmers. Studies that were conducted before ours in Accra and other parts of the country showed that organochlorines were still being used. So this inspired us to look at Ashanti region and look at fruits in general, because fruits are not processed before eating. Most of the time, it's either turned into juice or we eat it raw. In any case, these organochlorine pesticides will not break down, and so will get into our system. So we wanted to see if they were being used and what were the risks associated with its consumption. And that inspired us on to do this work.
So interesting point you make there. Since the 70s thereabout, and we're fully aware of this, we're not supposed to be using the likes of DDT and others, but people are still using them. We'll talk about the EPA and what they could have been doing, but were you shocked by the findings? Were you shocked by the levels of DDT and other pesticides we're seeing present in, fruits like watermelon? Did it take you by surprise?
Well, it did, because I was expecting that, looking at the number of years of ban, we shouldn't expect any at all. And so getting it in higher levels, the residues being greater than the threshold levels, maximum residual levels, was quite worrying. And on top, when we did the risk assessment and realized that children were at a higher risk of getting ill because of consuming these fruits, it was worrying. It was very worrying. It wasn't shocking, though, because of the other works, but we thought that we wouldn't hit that, we wouldn't meet that. We would get them in very low concentrations.
Right. So the other works, just to confirm, from what you're saying, it suggests that the other works have also pointed to the fact that we have a lot of these pesticides prevalent in our fruits. That's the picture I'm getting. Is that correct?
Not only in fruits, but also in vegetables and other crops.
Right. And I've heard of same for, cabbage and all kinds of other things. So I get your point there. But again, having conducted the study and with what it shows, why is it so alarming? Explain to us.
Well, organochlorine pesticides are poisonous, and they accumulate in the fatty tissues in our bodies, and they bioaccumulate. So, in a way, it is not going to live through excretion as others would break down in the body quickly and live. And they have the tendency to cause diseases, harmful ones like cancer, which you mentioned, and also the nervous system could also be disrupted. apart from that, these fatty tissues, breast milk, it has a tendency to accumulate in breast milk, which can be passed on to babies. And so it becomes a problem for us. And that is why I think that it's quite worrying.
This indeed is startling. What you mentioned to us. Is there any way of? I mean, I know I'm stretching this, but the fruits affected, especially watermelon. Is there any way for a buyer to be able to look or cut or do something to be able to determine that this fruit has too much of a high content of DDT or some other pesticide, and so I shouldn't purchase it? Is that because sometimes you would see these watermelon sellers, especially, they would cut it up, in displaying it, and they will tell you that, oh, it looks this way, so it is very juicy, it is healthy, it is this and that. I hear sometimes they even inject stuff into them. So is there any way for someone who is an end user of being able to determine that, no, this likely is contaminated?
Unfortunately, that will be difficult because without testing, nobody can say that this one has high levels of pesticide residues.
Right.
So I cannot say that by looking at it, you'll be able to say anything or which one has high levels and which one has low levels.
What per your study is the prevalence of these pollutants, if I may call them that, or pesticides in these? I mean, per your study, let's say if you examined 10 watermelons, were all of them affected? What percentage of it, and what picture does that paint?
So we did 5 communities, and the levels were not the same in all 5 communities. Some were higher than others, which means that it is not all the farmers that are using them as rigorously as others. So the prevalence, I would say that it is widespread, but then the use is according to the farmer. Some are reduced and some are kind of high.
What was the highest prevalence rate that you found, and what was the lowest?
So in some cases, they were not detected. So the lowest is not detected.
Right.
But in nanogram per gram, it went up to about, if I will refer,
right,
we had about 2.71 nanogram per gram, which, and then in some cases, it went up to 22.84 nanogram per gram. We had 48.22 nanogram per gram. So that kind of thing. The highest was about 48.22.
Right. So what does that mean? What does a 48? I mean, give me the scale again. Yeah. What does that mean? What does 24 mean?
So these are concentrations in nanogram per gram, or what we say parts per billion. But these concentrations are high based on the EU and other regulatory agencies' maximum residual levels. And so when they go beyond the maximum residual levels, we say that they are high.
Right. I was about to get to that. So what is the standard there? You've mentioned 2, you've mentioned 4, 24, 48. What is the standard? What should we expect when it comes to these? And so we can know by how much we've exceeded it.
So it depends on the particular pesticide, but all these organochlorine pesticide residues shouldn't go beyond 1 nanogram per gram.
Wow. 1?
Yes.
Most of them?
Yes.
So 1, and apart from those instances where you did not find any, you mentioned 2, you mentioned, if I got it correctly, about 4 or something of the sort, 24, yes. 48. So it means for those that contain about 48 of the measure you're using, yes. It means it is 48 times.
More or less, yes.
What should be expected?
Exactly.
Wow. Wow. Tell me, right before I move on to some of our other guests, so At 48, let's say, at that level, almost 50 times what the standard is. How rapidly could it affect someone who is, let's say, consuming that kind of watermelon, let's say, once or twice a week in about a year? What could be the impact?
Well, I said that it bioaccumulates. And so the ultimate is that the person will fall ill based on the bioaccumulation. And in our study, we took certain factors into consideration. When you are doing risk assessment, you have to assume certain things because it is just a calculation. And so the body weight of the adult was 60 kilograms in this case, and the body weight of the child was 10 kilograms. We looked at a estimated daily consumption of about 64 grams per day. And so that was what we used in our calculation. And so based on these assumptions, we also said that consumption, the absorption rate is 100%, which means that it's bioavailable. Every one of them, every chemical that is on the food will be available to the human being. That is it. So we estimated as 100%. And that was how we did our calculation. In reality, it may not be 100%.
Okay.
But in our calculation, we used 100%. Based on our calculation, we came out with the risk assessment, normal risk assessment, what we call the non-carcinogenic risk assessment, and the carcinogenic risk assessment. And we realized that in both cases, children were at a higher risk of falling ill.
Do hold for me, Prof. Bwedi. Let me bring in Dr. Charles Nyaba, who is, of course, president of the Peasant Farmers Association. Doc, thank you for joining the conversation.
Thank you.
If you could just speak a little louder, I'm struggling to hear you.
Yeah, thank you very much. Let me say good morning to Prof. And I think I'll be interested in seeing the findings of the study because it will be very useful to the producers who also act as consumers at the same time.
Right. Dr. Nyaba, so you're president of the Peasant Farmers Association. I just want to confirm a few things. You have members who produce watermelon, right?
Sure, you're right.
And for decades, we have banned the use of DDT and others. You're aware of that, right?
Yes, I do.
Okay. Have you had any instance of some of your members using this pesticide or DDT, not just in watermelon, but in other plant products that members of your association produce? Has it ever come up?
Yes. So farmers use all kinds of banned chemicals for several reasons, which may not be justified.
Right.
But I would like to link some of the reasons to poor monitoring.
Poor monitoring. Okay.
Poor monitoring, limited knowledge about the harmful effects of some of those chemicals on the health of the farmer himself,
okay,
on the environment, and the consumer. I say this because just yesterday I was in the Volta region where your colleague called me, and I saw a farmer using D4D container and then fill water in and was drinking. And this
was what? Drinking it?
Drinking the water.
Wow.
From that container. So this is how poor information are killing farmers day in and out, and by extension to consumers and the environment. So that's just what I can comment for now.
So we know that there's a problem in that regard. As an association, peasant farmers, what have you done in terms of educating your farmers? Because what you just mentioned, that thing there, it's basically a container that has been used for a poisonous substance. This person, I don't know what process they've gone through, but they shouldn't be going anywhere near it in terms of drinking. But the person is even drinking water out of this thing. So it means that the educational level is very low. But what have you done as an association to educate your farmers on this particular bit?
Yeah, I think the year 2017, 2018, we did a nationwide sensitization program to try to educate farmers to comply by standard in applying some of these chemicals and how to handle them, and even how to decompose the empty cans after application. But you see, the point is that we are farmers. We don't have the expertise like Prof. Nku, who will be able to actually give the detailed harmful effect on either applying them or handling them or even to the environment. And that is the role of PPISD and then EPA to actually send out experts to be able to do this education. And that is not done. In terms of even the application, where some harmful chemicals are banned from being used, farmers sometimes use it without even knowing that these chemicals are banned. Now, my first question even has to do with, if the chemicals are banned, how come we found them agrochemical shops being sold for farmers to have access to them in the first place?
That's a question on my mind too, and I'm going to be posing it to the EPA when we have its executive director. The question is why? But do go ahead with your submission. Do go ahead.
Yeah. So in the first place, it means that there is poor enforcement of the rules that we put in place to ensure that these things are not being used. That's one.
Right.
Two, because we also have limited extension officer-farmer ratio. You go to a whole community, and the whole of that season, they have never seen an extension officer with their eye. So, and these are people who will be educating the farmers on agronomic practices, on harmful effects of using certain chemicals on their own health, the consumer, and the environment. And then there are also instances where, because farmers don't have access to market, when they realize that in a particular week, there are buyers for a particular commodity like a tomato or pepper, and they have to meet that market, they forcefully use some of these harmful chemicals which are able to compel the produce to look ready or ready for market, and they harvest them for the buyer. Now, per what I know is that some of those chemicals, when you apply them on the crop, you have to wait for a number of days or weeks before those commodities will be wholesome for consumption. But because they are inherent to meet this market, they harvest them. The buyers also put them in the market. You, the consumer, going wouldn't even know that these are the harmful effects of this chemical. So we saw roasting, we buy them and we consume. So we are affected by all kinds of sicknesses that we are not aware of. Recently, I went to a farming community where they were storing meat. There is this chemicals which is very poisonous that sometimes they use to store the maize to prevent the weevils and other insects from attacking the maize. And when I read the instructions, after using it to store the maize, you have to wait for at least 3 months before those maize are ready for consumption. But there are instances where farmers will have to dispose those maize on the market less than the time frame that the chemical is meant for, because they need money to do one thing or the other. There's nobody monitoring how these chemicals are used and the time frame for the commodity to be disposed on the market. So these are some of the observations that I have made as a farmer myself and working with the farmer groups. But in most occasions, when we have workshops, we try to actually sensitize farmers on some of these things. But how far can we go? And this issue continues. So I think it's something that we should all be worried about.
Let me come to Dr. Kwejo Kusi, who is an agronomist with the University of Cape Coast. Dr. Kusi, thank you for your time as well. Thank you for joining us on the AM show.
Yeah, you're welcome. And thank you for having me here.
Right. Are you surprised? I'll put that same question I put to Prof earlier. Are you surprised at the sort of levels at which we have pesticides like DDT prevalent in some of our produce, especially in this case, watermelon? Did it hit you, as a surprise? Do we have Dr. Kusi?
Well,
right.
It's not a surprise to me at all. This thing has been there. Yeah. I said it's not a surprise to me at all. Yes, it is not today, it is not yesterday that it came. And this thing is worldwide, but that particular issue, it has been there from time immemorial.
Okay, so it's not a surprise at all to you, but we do know that substances like DDT have been banned for decades. Why are they still so prevalent on the market? That's a cause for concern, isn't it?
Yes, sorry. Yes, it is. It is a huge cause for concern because we know what DDT and these lindane and aldrin can do. But we shouldn't look at the point from the use. We should look at the point where the thing is imported to the country. Where does it come from? And all these things. So we should look at the link in the chain, starting from importation to marketers to the farmers and all that. So it is like drugs we sell in the market. Some of them are banned, but we still find them in some drugstores. We still find them in some pharmaceutical shops. How are they able to come to the shop? It means that people are smuggling them into the country and it is on in the markets being sold. And it's as if our minds is always on the banned ones. There are some that are not banned, but because it is being misused, it is serving the purpose of the banned ones.
So which ones, give us some examples of some of those that are not banned, and I get the point you're making.
Glyphosate is being used in the system.
Doc, it appears the connection is a bit...
let me give you just one example here. Oh, sorry for that. Can you hear me now?
Yes, it's better. Could you go back to the point you were making? You were mentioning some of those that are not banned, but are being overused or abused.
Yes, what I'm saying is that it's as if we are concentrating much on the DDT, the lindane, and others. But the ones that are not banned are also being used so that the same effect we are having from the banned ones is getting that are not banned. For example, glyphosate. Other countries are trying to ban glyphosate. For example, Germany. The cabinet in 2020 have said that by 2024, they will get rid of glyphosate from their system, from the use of, for farmer use. But we don't have any roadmap like that. Farmers are using these things without concentrating on what is written on the labels. For example, Dr. Nyaba said something that there is something called PHI, pre-harvest interval. So a farmer is supposed to look at the label and look at the instructions. Some of the instructions on the labels are misleading. For example, you have stated on the label that PHI is equal to 14 days. The farmer who has bought this chemical doesn't know the meaning of PHI because he hasn't been educated on it. So if you don't write pre-harvest interval, which might be somehow okay, but you write PHI is equal to 14 days, where it means that the farmer, when he applies the chemical today, he should wait for 14 days before he can sell the produce or harvest the produce. So before you harvest, within 14 days, but they apply the chemical today, and then somebody comes tomorrow to buy the produce, and then they harvest it for them because they need money for something else. So some of these things, as Dr. Nyaba said, that the education is low. So we should concentrate on all agrochemicals, not necessarily the banned ones. The bad ones are there. We should talk about that one, fine. But the other ones that are being abused. For example, I have stated that some farmers we went to, when we interviewed them, some of them, we asked them, how are you able to apply the chemical on your crops? And some of them said that what they do is that the cap, the container cap, sometimes you see that there are some caps they attach to the container that should be used for measurement. What they do is that because some of them can't read and write, they just pour some of them in the knapsack and then spray. Sometimes the funny thing or the serious thing is that they keep on pouring and then they taste it. They even dip their fingers in it and then touch it on their tongue to see whether the concentration is very high. So if it pinch their tongues, it's wow, this one can kill the insects. So the continuous tasting, and then the way they apply the thing without using the protective clothing and all that, farmers will have dizziness, headaches, itchiness. Some of them are even with sexual weaknesses, if not impotency. So it is a huge concern.
And all of this that you're mentioning, even the sexual weakness and the impotence, on the back of, for lack of knowledge, even tasting these things. And of course, sometimes not using the right protective gear. They are suffering all of these things.
Yes, they are. And if they are doing that, what about us who are also eating it? And then the sad thing is that the innocent consumer cannot see, as Prof said, the innocent consumer cannot see that this cabbage I'm buying, this watermelon I'm buying, this vegetable I'm buying is contaminated. So the link is so long, and if we don't take it step by step to look at every link, we will start from the farmers, but we will not get anywhere because the chemicals might still be in the market. So I think we should take it as a holistic way of doing it, from parliament, from government to parliament to EPA to PPRSD, to the farmers, to associations, and to us, the consumers. Even for MOFA, training these extension agents to, organize the farmers and train them on these things. It is funny enough that some pesticides that are supposed to be used on crops, that are not supposed to be used for other crops, are used on the crops. I said yesterday that one farmer we visited, a cabbage farmer, his crops were doing so well. You can see that there are no insects on the field. Then we asked, what are you doing? He said, unfortunately for me, I got some chemical from my friend, and it has been helping a lot. So we said, okay, if you have the container here, let us see so that we can also recommend for other farmers. Then he brought it, and it was cocoa akati master. Some chemical, some agrochemical that is used on cocoa.
Right.
And if you look at the cocoa, the skin of cocoa or the rind of cocoa is very thick. Right. So when you use that one, for the residue to be in the beans is somehow minimal. But on cabbage that is eaten raw, that is used in most salads, and they are using cocoa akati master on this one. It is very critical that we need to take a look at it again.
Wow. Some of what you're telling me this morning is downright scary. Look, from the abuse of some pesticides that are legal, are meant to be used, but they are being overused, to the use of banned pesticides, and now to the use of pesticides that are not even, because they are crop specific. And in this instance, like you rightly said, cocoa has a thick skin, so the absorption rate getting to the pods might be difficult. But cabbage, and you're spraying directly on it, people consuming that over time are definitely going to suffer the consequences. Which brings me to my next question. Professor Boedi, I would like you to address this one for us. Looking at some of what has been discussed here this morning, where should we lay the blame? The Ministry of Food and Agriculture is there. We have the Environmental Protection Agency. Have they been up to the task? If all of this is going on, I want to believe that all of us at some point have consumed, whether it is watermelon today or pineapple tomorrow or cabbage here, we've consumed products that have gone through this, funneled through this cycle of either using the wrong chemicals or overusing the right chemicals and all of that. Where do we lay the blame?
Well, I'm glad you said you're going to get the EPA boss on the show. This comes to regulation, because if the chemicals are in the system, then farmers, if it's available to farmers, they will use it because it is very effective. But if the chemicals are banned, then they shouldn't be in the country at all. Some of the farmers are ignorant of the chemicals that they are using. And so I cannot just put the blame on the farmers. There is supposed to be education, which other speakers have talked about. And so I will still look at the government regulatory agencies who are supposed to ensure that these chemicals do not get into the country for them to be available to the farmers. So I wouldn't say I'm blaming EPA or FDA or any of these organizations, but I think that if we are strict on importation on some of these chemicals, the ban, if we enforce the ban, then it will not get to the farmers for them.
But that's exactly my point, Prof. You see, the buck must stop somewhere. The blame, like has been mentioned, Germany has its regulation and they are planning when it comes to even some pesticides. Moving on, do we have a plan? If we don't have a plan, why don't we have a plan? Are we not aware that these things have been happening? Because I've heard of these things even before conducting this interview. For years, I've heard of the fact that DDT is being used in certain areas, which is why you would want to be careful where you purchase certain fruits. But so my question is, if we don't lay the blame somewhere, how will we get any resolution to it? I am not in charge. My only situation would be that maybe in purchasing, I might want to be more careful where I'm buying my food from. But there are regulatory bodies that should be acting. If they are not, shouldn't we blame them?
Yeah, so in this case, the regulatory agencies are EPA and FDA. And Ghana is a signatory to the Stockholm Convention, which bans these organochlorine pesticides. Ghana is also a signatory to the Rotterdam Convention, which is supposed to regulate the importation of hazardous chemicals and the rest. We also have the National Narcotic Control Board, which is also there to regulate some of these chemicals or banned chemicals. So they are all supposed to help the system so that the country is cleared of some of these harmful chemicals. But once regulations are laxed or not enforced, and people could smuggle these chemicals into the country, then such things will continue to happen.
Dr. Nyaba, in terms of addressing the issue, apart from the planning weaknesses that we have in our system, Dr. Nyaba, what would you say we ought to be looking at? Is it the tightening of regulation, or what do we have to do? Do we have Dr. Charles Nyaba?
Yes, please.
Yes, Doc. That question was directed at you.
Yeah. Please, can you mention the question again?
Okay. So I was just saying that beyond some of the challenges that we've mentioned, beyond our lack of planning, for example, that we have seen in terms of dealing with some of these pesticides and even phasing them out, what more can we do by way of regulation and education, especially from the standpoint of agencies like the EPA, and again, you could talk about the overarching Ministry for Food and Agriculture. What more should we be doing? Because it appears we are just feeding our population with diseases, and it will come back to us with health consequences and with cost consequences for our country.
Okay, so I remember, as I said, 4 years ago, we were trying to do some work with the EPA, where they were to educate some lead farmers because of limited...
Dr. Nyaba, my sincere apologies. Before you answer that question, I just want to do this, okay? Because of the urgency of the situation. We have the executive director for the EPA, Henry Kokofu, and I want to have a state because they are crucial in this discussion. So with your permission, Dr. Nyaba, let me bring in Mr. Kokofu. if that is okay with you. Dr.
That's
Kokofu.
fine. Yeah.
All right. Dr. Kokofu, a very good morning to you. Thank you for joining the conversation.
Good morning, sir.
Great. So you're fully aware of the situation. We're talking about the use of some banned substances like DDT on our farms to, make produce ripen before their time. But in this discussion, just to give you a summary of what we've had so far, we've spoken about the fact that these farmers are using some pesticides that are legal, but overusing them. We also have other instances where they are not even using crop-specific pesticides. So something that is used, akate cocoa, it is used on cocoa beans or pods. It is being used on cabbage and the rest. What is the EPA doing about this situation? How come people have access to DDT, for example?
Well, thank you very much for the opportunity. When you come to EPA, we have a center called CCMC. That is the Chemical Control Management Center. And it is well-equipped facility or unit that has capable men and women who are qualified to, as it were, control the use of chemicals in the country. Indeed, importation of chemicals, we do also have an input as to permitting. The whole situation has been the abuse of almost everything in this country. The normal drugs or medicines for consumption. If you call the FDA, if you contact our medical health, the public health systems and all that, you get to know the abuse, the top abuse of medicine. Whether herbal or orthodox. So be any other substances or products that we find ourselves in. DDT, as it were, the full name is diphenyl trichloroethane. It is a pesticide, and it is among a number of pesticides that has been banned in this country for long. The use of it, the importation of it has been banned. And it is in conjunction with the Stockholm Convention that sought to internationally ban the use of all the basic chloroethanes, if you like. Now, the use of pesticides in general has been something that, as a nation, we need to look at it critically. You rightly said that there may be an unbound substance used as pesticide, but as to the volume, as to the percentage, the usage, the method or the procedure or the processes through which these substances are to be used is lacking, and that is squarely the lack of knowledge in all these directions. That's why we've been advocating for farm extension officers who have requested knowledge in these things to be on the farms to educate farmers on the use of these materials.
But all of that, you see, I was saying shortly before you joined the conversation that the buck must stop somewhere. We know it is banned. Why is it even accessible? Because once it's accessible, people will use it. And why isn't there the right education on these pesticides so that they will not even be used? Because from the discussion, the thread shows that a lot of these farmers don't even understand what they are doing. Some are even tasting the pesticide. That's how dangerous it is.
Yes, it's banned. So officially, we don't expect this importation in the system. However, you and I know the smuggling of most of these contraband goods into our society or onto our land, and through the various illegal routes of entry at our borders, the porousness of our borders, we all are aware of. We've been doing and taking steps to do sampling on the market to try to check some of these things. But it's unfortunate, and people are so recalcitrant and always want to do. We want to invite the researchers. We want to know more and further, so we can close in on exactly where the findings are, or what they found it, so that you'll be able to, by way of recommendation, also get down there and then work on it.
Just to chip in, this latest one, and it's not the first, but this latest one was conducted in the Mampong area in Ashanti.
Okay.
And it is alarming because when I was interacting with Prof on this bit, Professor Bwedi, he mentioned that per EU standards or, global standards, you should have, I've forgotten the measurement he used, but just about 1% of it prevalent in these crops. In some instances, we have as much as 48 prevalent in the crops. That is disastrous. I mean, someone consuming watermelon like this for about a year. So what are we going to technically do about it? What more can the EPA, for example, do about it to protect end users?
Yes, we're going to collaborate more with our other stakeholders, our institutions or authorities. FDA, for instance, the Ministry of Agriculture, the department or the unit that deals with pesticides and all that, we're going to also have. And we have a committee in place. I've asked my director to immediately convene that pesticides committee so we'll be able to dissect the research findings and then do further engagement. The agrochemical sellers industry have blossomed or have boomed over the years, and they are scattered all around. You've taken steps to re-register them, re-license them, and then weed out all those illegal activities or those who engage in some of these illegalities, because the farmers get access of these chemicals or products from these shops and all that. So it is a major stakeholder engagement that we've got.
Okay, right. So you speak of stakeholder engagement. Just to wrap the conversation with you, I just want very practical solutions. To wrap from your end, you are the EPA.
Yes.
You have what you have to do. You know exactly what your mission is, your vision, and what is expected of you. On the back of this, because there have been previous reports, on the back of this latest report, do tell me, what measures are you going to put in place as an EPA? So we should expect the EPA to be in Mampong. We should expect the EPA to have some sort of discussion with the KNUST lecturers who conducted the study. We should expect the EPA to do X, Y, Z. Can you give me a roadmap? Just something that we can expect the EPA to do on the back of this, within this quarter or this year?
Yes, 2 months ago, EPA was on the ground. We see some of these products in Teshiman. Currently, as we speak, Ashanti region EPA is undertaking market survey of some of these. There are others that are even not banned, but they are not licensed and their efficacies are suspect. So, yes, I agree with you that we should hit the ground running. We are already on the ground, but we're going to intensify and then work collaboratively with the police, with the other agencies that I've mentioned, FDA in particular. You've been collaborating with them all this while. So we're going to go ahead and do the market surveillance and then other. It is not Mampong alone. The mapping of agrochemical use centers mostly within the Ashanti regional enclave, leading to Bono and then Bono East region. And then the next place of prominence has to do with the northern region. So we're going to encompass all those areas and then make sure we clamp down on the use, importation, illegal importation, and distribution of these substances, particularly the DDT that we talked about.
Dr. Kokofu, so if we come back to you in a month, you would be able to give us some positive update. The EPA would be on the ground working on this specific situation. Can you confirm for me?
You may not necessarily have to come to us. We may even come public and then you will ascertain. You may have to go back and then see whether the problem or the challenges are tackled. Meanwhile, the researchers, we're going to extend hand of invitation to them, and our doors are open. First, they can contact my office at Kumasi, or I'll ask the Kumasi Ashanti Regional Director to get in touch with them, and then we follow it up. So Thank you very much. And I think the media is doing quite a good job. The awareness creation and education of environmental issues, particularly those that borders on public health, like as we are discussing, is quite paramount in the fight against illegality, so far as environmental governance and health issues are concerned.
Dr. Kofu, we greatly appreciate your time. Thank you for making the time to speak to us this morning. All right. Just to wrap off the conversation. So, gentlemen, Professor Bwedi, Dr. Nyaba, and Dr. Kusi, I'll give you less than a minute each if you can manage it. What is the way forward? What should we be doing? I'll start with you, Dr. Nyaba.
Yeah, so I think the EPA boss outlined a very good initiative. Education is key. We need to try to sensitize the farmers, sensitize the consumers, but I would want to also suggest that in addition to that, if we can introduce something like a barcode that once in a while maybe EPA or whichever body is concerned will just take sample products and try to scan them to know the level of chemicals in them so that we'll be able to enforce whatever we want to do. And then we should also try to enforce the policies by at least do routine checks in our agrochemical shops to see the kind of chemicals that are being sold, especially the DDT.
Okay. For your concluding comments, Dr. Amwa?
Yes, thank you very much. I think that, as I said earlier, we don't have to take this thing from just one link in the chain. We should start from the government down to Parliament, to EPA, to PPRSD, to MOFA, to the farmers and to the consumers. But starting from one point, one study that we were trying to do is to do traceability studies. That if you go to a bigger market, you buy some vegetables and then you check the levels of these chemicals, and then you trace back to the farmers. When you find out that the farmers are aware of what they are doing, there can be legal issues, so that market women will not buy from them. The farmers will stop using that because now they know there are legal issues in this, because it's very critical. So my wish is that there are other things we can do at a farm. As an agronomist, I know that there are certain things we can do at a farm that can reduce this. But we should take it holistically, because if the chemical is not there, definitely the farmer will not use it. Right. But if it is there and he's using it, what is he supposed to do? We should have a roadmap that, let's say, by 2026, Ghana is going to eradicate this. Ghana is going to do this.
Okay.
That is what we should do. We should come together as a group and then work together so that we can get rid of these things that are harmful to human health.
Professor Bwedi, you have the final bite. Some 30 seconds if you can manage it.
Thank you. So I will still come back to a regulation that we should ensure as a country that these loopholes are blocked, and the law enforcement agencies are up to the task of stopping the smuggling in of these banned chemicals. Also, there should be regular monitoring on the markets, as the EPA boss has said they are doing, so that some of these problems can be kept, that it will not lead to an environmental or health crisis in the country. Thank you very much.
Thank you so much, gentlemen, for joining the conversation. We had Professor Nathianolo Owusu Bwedi, Department of Chemistry at the KNUST. We had Dr. Charles Nyaba, President of the Peasant Farmers Association of Ghana, Dr. Kwejo Amwa, agronomist at the UCC, and Dr. Henry Kokofu, Executive Director, EPA. We'll keep our eyes and our tabs on this matter. But after the break, when we return, we'll be talking about more pertinent matters when it has to do with the law. We'll be right back.